it's Joe Pardavila. Welcome back to the Forbes Books Podcast. And if you were to type in healthcare is broken on the Google machine, you would get over 222 million results. We've all heard about the problems, but what are the solutions? Joining me this week is Dr. Matthew Kolinski, a physician and entrepreneur who is using his past experiences to apply a new way of thinking around the business of healthcare. He's the author of the book, Work, Passion, Life Balance, Finding Fulfillment Through Zones of Efficiency, and the host of the new podcast, Reengineering, the Business of Healthcare. Hey there, Matthew.
How you doing today?
I'm great. Thank you very much for taking the time, Matthew. And you are one of these guys, and I'm seeing a lot of these multi-hyphenates. Being a doctor is not enough for you. You need to do more than just being a doctor and helping people day to day. There's more to it. So talk to me about, first of all, your medical background that then makes you this multi-hyphenate.
Sure. So thanks for the introduction. But, ultimately, I love my life, and I'm happy to talk about how I got here and what makes it up. So yes, I am a doctor, went to medical school and residency, did double training in internal medicine and pediatrics. And I was also an entrepreneur way back even when I was 16 years old. And so I started my first formal business in undergraduate, writing resumes for classmen that were graduating. And that really got me into this whole pathway of human capital management while I was in undergrad and medical school. And so this hyphenated that you're talking about is really this entrepreneur and physician. And together, that's really what makes me happy and full of life.
And so how have you transitioned now in terms of balancing what you're doing as a doctor and this entrepreneur, quote unquote, life you're living? Talk to me about that.
Well, one of the things I've noticed growing up is, you have to make sure you take care of yourself and find what makes you excited and happy throughout the day. And so patient care is one of those, activities, those passions that I have. And caring for patients when they're sick and vulnerable is something that I cherish, and I'm honored to be part of those discussions. And so when I was in medical school and residency, I started a business called USA Staffing Services. And while I was in medical school, I wanted to be able to pay for medical school through a business opportunity so that I can focus 100% of my time on patient care. What ultimately happened was at the end of residency, I realized that I was partly an entrepreneur and partly a physician. And so I was able to find a job where I can work nights and weekends as a doctor and work during the day on the business. And that ultimately led me to have a great work, passion, life balance. And in over 16 years, I've been able to modify that. And I actually wrote a book in 2020 with the same title, Work, Passion, Life Balance.
And that leads me to my question in terms of, I've seen a lot of doctor TV shows, whether it's Grey's Anatomy or ER, fill in the blank. It seems, and I've seen doctors in real life, it seems like it's a really, 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 really hard job, and the medical school process seems like a really, really, really way to get an education. So how does one human being do all of that in terms of a work-life balance when you're dealing in such a very difficult industry?
Well, it is challenging. And I think, one of the takeaways from writing the book was actually thinking about how could people find a balance and really maximize their life satisfaction. And so, from my experience, I took 16-year period from 2006 all the way up to 2020. And I really wrote about my life story and how I did it, my journey, my failures, my successes, my good decisions and my bad decisions. And I wrote it all out there with the goal of hoping that somebody else can make less mistakes than I did. Right now, physicians and healthcare providers have a lot of challenge. There's insurance companies, there's hospital regulations, there's patient expectations. And so you get pulled in a lot of different directions. In addition to that, in early 2000s, healthcare really changed from a physician provider focused profession to a business. And us as doctors have not been able to keep up with that transition. And so one of my goals in the next 20 years of my life is to help bring physicians and medical providers back into the center of the discussion so that they can have a better quality of life. When you're being pulled in so many directions by an insurance company, the hospital, patient care, patient expectations, you don't like your job as much when you have to spend 90% of your time doing billing and notes and only 10% patient care. And so my hope and my goal over the next several decades is to bring the provider back in the middle of it and help them really maximize their life while they're working.
And one thing you did not mention there, Dr. Kolinski, is the fact of physician burnout. And I know there was a recent survey that, nearly 44% of doctors experienced burnout. And I'm sure that has been exacerbated due to the pandemic. So talk to me about the entirety of what you're speaking about and factoring in this physician burnout.
Well, physician burnout is one of those hot topics that I would say I read about every month, and over the past 3 years, we're really starting to define it as an emergency when it comes to what is the life expectancy of a provider in terms of how they can care for patients. If they're getting burned out in their 30s, it's not going to be a great rest of their 40s, 50s, and 60s if they're going to stay in the profession. One of the challenges is really the expectations on the provider. So over the past decades, we've been reducing patient care with increasing those notes, like I mentioned before. And part of physician burnout is not being able to do what they're really good at, which is the patient care, taking care of the patients and making the decisions in the best interest of the patient. And so burnout occurs because either they're stressed over what the provider or the hospital is making them do, they're stressed over what the insurance is requiring them to do, or ultimately, they become a secretary in many ways of note writing instead of patient care. And so I really believe that there is a change that can be made. I believe that there's a lot of great thinkers out there that are coming up with new ideas. But when I talk about in my book, Work, Passion, Life Balance, I talk about it's actually partly on the responsibility of the provider to make time for themselves. Too many providers go into practice with 300, 400, 500,000 in school debt, and they want to work so hard to pay down that debt that then they lose the next decade of their life. And they don't, they miss out on the time with their kids, and they miss out on the time with their wife or significant other. And what ultimately happens is they get 10 or 15 years in and they don't have meaningful relationships. And so my book and my experience and my philosophy talk about who are those relationships in your life and which ones of those relationships bring you joy, bring you energy, fulfill you in ways, and make sure you focus on those relationships and care for them. Part of my experience is that during my residency, I shut out a lot of people. I turned away from relationships that I should have been leaning into, which caused me to have some stress and anxiety and fatigue, during that process. And then the last component of the philosophy is really that you should understand what you love to do by yourself and make sure you have time for that. And it might be patient care, but it also might be gardening or boating or fishing. And you have to make time for those activities, because if you can't love yourself and you don't give yourself time to, get to know in a meaningful way, then nothing really can help you from the outside.
And one of the cures, for lack of a better word, for physician burnout, I've noticed are these entrepreneurs like yourself that are balancing entrepreneurship with their everyday doctor or nurse or, medical field job, that these side gigs are a big factor in helping people through that fatigue and that burnout.
I would say that a physician is naturally entrepreneurial in the basic forms. I mean, if you think about the 80s and 90s, and maybe even the early 2000s, you would graduate from medical school, you would go to residency, and then you would hang your flag and start a practice. And so I think, a lot of people got into medical school, got into the idea of providing care for patients with the understanding that they would be a business owner in some way or form, or buy into a practice, or, really be in control of their work day. If they wanted to go home early to see kids, they can, cancel patients, or they can reschedule patients. And so that old school, if you will, version of physicians and providers is very entrepreneurial in nature. And so I think that still is a carryover into today's physicians. I think the main difference is that we're restricted with 12-hour shifts, and we have, a certain number of patients we have to see per hour because the insurances and the hospitals and the clinics are requiring it. And so I think that it's actually going against their grain to be employed, but at the same time, they have large debt from medical school that's making them, work extra shifts. So instead of taking off the weekend, they're actually doing extra shifts in the hospital. And so I think that has always been there. One of the interesting thing in the past is a lot of times physicians would invest, into businesses and have a diversified kind of revenue source. What I see today is that physicians are going down to 20% or part-time work in the hospital and then really get into new ventures. And so I feel like I'm one of many physicians who have done that, who've gone into a completely different industry where I'm actually taking an operational role in that industry instead of just kind of an investor in those businesses.
If you could help me out with this question, how does a doctor who decides to, as you mentioned, they're sort of inherently entrepreneurial, but how do they get clients in this day and age? Because I know as a kid, it was always, family doctor that's been, handling a family for generations, and then you took, they took you, and then you took your kids. So what is the baseline now for doctors to grow their business and get more clients?
Unfortunately, it's really tough. Like you mentioned, they don't have that legacy approach to patient care anymore. In the early 2000s, larger hospital systems started to buy up all those individual small practices. So, going against the grain and starting a practice now is tough from many fronts. The one that you're talking about is the customer acquisition, if you will, or
right.
Patient acquisition. And that is, it is really tough. So, logistically, you have to get on the insurance plans and you have to be approved by the insurance company. But that means that you as an individual provider have to get onto multiple insurance companies and have multiple listings. And so it's a lot of paperwork and logistics that need to go into a practice. Oftentimes when you're part of a larger practice, if you join a large hospital firm, they'll do a lot of the advertisement for you. But again, since the insurance companies kind of control the flow of money, they control the flow of patient care as well. And so insurance oftentimes sends patients to the providers that they have to reimburse less because the insurance company wants to make money as well. And so by having the insurance company control the flow of cash, it really puts the power of negotiating fees, of patient acquisition, all into the hands of the insurance. And I think that's one of, when I think about re-engineering the business of healthcare, I think that is one component that needs a serious revision on and put in perspective. It's one of almost the only insurance, type of industries, meaning healthcare, where the insurance makes the decision for all parties involved instead of the other way around.
And so let's talk about re-engineering the business of healthcare. I hate to dwell on negative and talk about all that's wrong with it. The term the healthcare system is broken is a cliche at this point. Everyone knows it is. But is it because of insurance companies? Is that how we got here?
I think that's one component of it. The other component is that physicians themselves have not been thinking about their value to society in a business way. So they let other people dictate what their value is and let other people run the show when it comes to business decisions. When I think of reengineering, I think of 5 key categories that all providers, whether you're in a small practice, a medium-sized practice, or even a large healthcare system, should be thinking about in terms of optimizing their business and optimizing their practice. One of them is technology. A lot of providers who are in the small practices just can't keep up with technology as much as the medium or larger size, so they're at a disadvantage in some cases. Organizational structure, something simple as having job descriptions and expectations for the team involved can go a long way in terms of not only creating organizational structure, but also building culture. And culture is that third component of reengineering, where you have to create a culture where you are represented by your medical staff, by your nurses, by your medical assistants, even by the secretary who answers the phone. You have to represent that patient care experience to all patients who call in, even the frustrated ones that call in multiple times per week. The other 2 components of reengineering is the processes and strategy. And I think those always go hand in hand. What is the strategy to grow patient care? What is the strategy to optimize care? What is your strategy to really provide that best care to your patients? And that requires processes to be in place, whether it's how do you schedule patients, how do you bill for your time, how do you follow up with insurance companies. All 5 of these components are required to optimize your practice. And it could be a one-person show, a 10-person practice, or even a large healthcare organization.
And talk to me about what's happened to this point, because obviously the healthcare system has been more digitized in the last couple of decades. How much easier does that make it for doctors? Because I can only imagine the mounds of literal paperwork that doctors had to handle on a daily basis. How has the digitization helped doctors in the front lines?
It's helped and hurt. And I would actually argue that the potential to help was actually reduced by the insurance's role in the digitalization. And so what I mean by that is when I was going to medical school, most of the hospitals I rotated in were paper charts. And so when you write a paper chart, you can write a note of the most important things that the patient needs for that day. And you write it out in a way that is meaningful, but yet cuts to the point. Like what is going on and what needs to be done for the day. And the doctor would then write an order to change any medications. Today, with the digitalization of healthcare medical records, the insurance companies are quickly denying claims because you're missing one component in a digital note. And so that is why 90% of our time as providers is spent on note writing instead of patient care. And so while it's made it easier to find certain aspects in records and lab tests and imaging, the insurance companies were a little bit smarter and ahead of the curve. And they said, well, since you didn't specifically ask about headaches, even though they're not here for headaches, since you didn't ask about it, we're not going to reimburse you for this day of care. And so it gave the insurance companies a way or an excuse to deny more or to have a higher expectation of the note process in general. And so I would say while it helped us in many ways, like lab results, imaging results, plans of care, what it's hurt is it's given the insurance a little bit too much power in denying care or denying reimbursements or payments for the services rendered.
So I'm a comic book guy. Spider-Man has his supervillain Sinister Six, and we don't need to name six, but who are the Sinister Six here? Obviously, insurance. Who else is to blame, or not even blame? Who else is responsible for the position we are in now?
I think it's a kind of one of those roundabout type of stories. When insurance premiums go up, people or patients expect more services for the payments they're making. And so they go into the hospital saying, I want 3 CT scans a year. I want the cardiac cath. I feel a little chest pressure, do the works. And because they feel entitled to the care because they're paying a good portion of their paycheck to the insurance. So I think it's a kind of a circular effect. When the patients pay a lot of money for their insurance benefits, they expect a lot in return. In the meantime, the hospital is set with a reduced margins because they're getting reduced reimbursements from the insurance, but they need to make the patients happy. And so they start squeezing the physician's compensation. And the physicians' compensations have actually been going down for a lot of primary care, for a lot of hospitalist work, because they're the most easily squeezed providers in the healthcare system. And so the healthcare providers are getting squeezed, their compensation goes down. And so now they're not, the happiest. And so now they have to pick up extra shifts to make the same money they were making squeeze. And so I think it's this and so now they're getting a rushed experience for the patient. They have to see 6 patients an hour in primary care. And if you think about it, 6 patients an hour, when you walk in, walk out and do an exam, you're really only left with 30 seconds to really provide any type of personal care to the patient. And so that patient then demands, more tests because they feel like they're not being heard. And so it's a cyclical approach. I do believe that with insurance controlling the cash flow, that has to be the number one thing we look at. I think the second big thing is the larger healthcare systems are growing at a rapid pace because they're buying up all of the private practices throughout the country. And they've been doing this for 10 or 12 years now. And when you buy up the private practices, the small businesses within the healthcare community, what ends up happening, just like in any economy, is that the intuition, the ingenuity, the new way of approaching things kind of goes by the wayside because a lot of that development was done from small businesses and medium-sized businesses, people who really have a pride in their practice. They want to make it better. When you just buy up all the private practices and make these large conglomerate type of university style healthcare systems, ultimately, you have a lot of people to make happy. And so you can't please everybody in those large healthcare systems. So I think it's a combination of multiple things.
How did this Walmartification of the health industry happen in terms of these giant conglomerate health systems just eating things up? Is there like a line in the sand where this happened, where like this is what flipped the switch? And it's like the old story, when Walmart comes to town, all the small businesses go out of business. So how did this happen with these big hospital chains?
There's a couple of answers, and I believe it started in the early 2000s. Around that time, insurances started to have the availability of electronic medical records, which then led to them denying more claims for reimbursement to the providers. And so when you have a decrease in revenue due to the insurance companies not paying as much, what you're forced to do as a small business is to cut services or to sell your practice, because you can't afford to have two people on your payroll just to fight the claims of the insurance company. So as it got more difficult to get paid by insurance companies, a lot of the private practices ended up selling off because they just didn't want to deal with it. Unfortunately, what happened was the large healthcare systems would pay money for the practice, and they would give these great salaries. Like, everybody should come over. It's a great salary. And in the salary contract, it says that the hospital can change your compensation at any given notice. And so they don't read that. And of course, they all sign. And then as soon as the last person signed, they change all their compensation and say, oh, well, you actually have to work harder now to get that same compensation. And so, I think it was a business decision by the healthcare organizations, but it was also an opportunity by the healthcare organizations to see that these practices were struggling. They wanted to make it more efficient. So they hired a lot of people with MBA degrees, and the MBAs started to run the hospital, even though they had no healthcare background.
They're just running on data, right? Anymore. It was just all about numbers.
Yeah, so they took the physicians out of the leadership roles, replaced them with people with business degrees, and what you got is a system that's well-oiled from a business standpoint, but doesn't have that healthcare expertise of physicians really leading the pack. And that's partly our fault as physicians. We were not keeping up with the trend. We gave the power away in the early 2000s, and I think what I'm trying to do is get that power back into that decision-making back, the leadership ability back into the hands of physicians.
Are doctors basically victims of their location if they live and operate in an area where one of these systems exist, where it sounds like they're pretty much everywhere? You can't survive on your own. You have to be part of one of these organizations.
It's tough. When you are a specialty provider, then yes, you do depend on the large volume of patients from a healthcare organization. So if you were a surgeon that specialized in a very specific surgery that not many people need, you're going to need a bigger patient population. And the healthcare system is set up to be able to refer those patients to you as a specialist. And so there's a lot of good that can come from these healthcare organizations. I wouldn't put them as all bad. I think they were necessary, but at the same time, it put a lot of the small businesses out of practice. I think that when it comes to your location, the best part about being a physician is you can move wherever you want. You do need a new state license, and that's slowly changing, but you can move, and a lot of physicians do move for better opportunities. So I wouldn't say that we're a victim of our location, but rather a victim of what you want to do with your life. If you really want to be a primary care provider, it's just really tough to start a practice nowadays due to the overhead needed to file claims with insurance. But there are ways to do it. For instance, you could do a cash-based business if you wanted to really provide private pay primary care for people who are willing to pay cash for it. But the downside is that you have to do the marketing, you have to get your patients, you have to do the billing all by yourself. And so it does become very challenging to do primary care by yourself these days.
Well, I can't talk to a doctor without addressing the big giant elephant in the room, the pandemic and COVID. Looking back now, a year plus later, how do you think your community handled it and what it's looking like now?
I think in general, the doctors that I know did the best job possible. And when you don't have a lot of the data readily available, you have to make the best educated decision. So I believe that the healthcare medical community did a wonderful job caring for patients. I believe that the patients I saw in the hospital who did get infected were well taken care of. And I think that, when it comes down to it, we don't focus a lot on preventive care or healthy living. And that is what really caught us off guard. The people who really struggled with this pandemic in terms of being infected were the people that had chronic diseases, obesity, a lot of diabetes, heart conditions. And I think it was an eye-opener. I hope it was an eye-opener for a lot of patients and providers to say, hey, if we start thinking more about exercise plans and healthy living, then this type of pandemic might not be as severe if the majority of our population were living a better, healthier life. And so I think there are a lot of learning opportunities, but overall, the providers out there work very hard, the nursing staff, mid-levels, physicians, dedicated to the care of patients, and that's all we can ask for.
And lastly, Matthew, a recurring theme, I guess, plot line of our conversation has been the fact that, physicians don't have control, and the control is mostly in the hands of the insurance company. Very simple question to probably complicated answer. How can physicians take back more control?
Well, education is one of those main components that I believe can help anybody in a situation like this. So educating about what is the value of you as a provider and how can you have a positive impact on the lives of patients. We are kind of in this big cogwheel of motion. You need to get paid in order to pay your school loans. In order to get paid, you need to see 6 patients an hour type of cogwheel motion. And so I think part of it is educating the healthcare system as a whole, educating the providers, and more importantly, educating the patients. And so I do have a lot of theories about what could work, but again, it's such a big change in our organization that we really need to start with one example, one hospital, one healthcare organization that makes a change for the better and see the ramifications after that. We've tried things like HMOs and PPOs and types of insurance, but at the end of the day, they always controlled the money. And so when you think about the education of a business, of an entrepreneur, every business is dependent on cash flow, and healthcare is no different. We just have to decide, are we going to let the insurance companies control the cash flow, or are there new opportunities where we can, as providers and as healthcare organizations, control the cash flow to help maximize your business so that you can maximize your patient care and physician life, satisfaction, and all of the healthcare workers. And so education is the biggest thing, and that's really the start of any big change in a industry where it's been around and done certain ways, for decades.
It's funny. The medical industry, we don't realize how we're sort of still like in the early phases of it. I don't know if you've read the Rockefeller book Titan, and one of the things that struck me was that back in like the turn of the century, like late 1800s, early 1900s, there really wasn't medical school. Like if you wanted to be a doctor, you just apprenticed for a doctor, and then you became a doctor. So the fact that in the span of like 100 years, we've grown to this level, but it's still early on in civilization. Isn't that kind of crazy to think about it? That just like less than 100 years ago, people were becoming doctors by just hanging out with a doctor.
Yeah, even like 50, 60 years ago. You're absolutely right. I would say that, with the advances of knowledge and technology in general, we're increasing our medical knowledge. We're doubling it every 10 years now. Mm-hmm. And so what they had to learn back then was nothing compared to what we have to learn now. And so I agree. We're still in the dawn of transition, and I think we're just ready for the next phase.
His name is Dr. Matthew Kolinski. Find out more about him at MatthewKolinski.com and be on the lookout for his podcast, Reengineering the Business of Healthcare. Dr. Matt, thank you very much for the time. I really appreciate it.
Thank you. Have a great day.
Coolio, and that's it for this edition of the Forbes Books Podcast. If you enjoy the show, make sure you take a second to subscribe so you automatically get new shows when they drop. Also, if you have a minute, I'd love if you left us a review so more amazing entrepreneurs like yourself can discover the show. And please, don't forget the golden rule and treat others as you want to be treated. Thanks for listening. Until next time, adios.
This has been a production of Forbes Books Radio. Find out more at ForbesBooksRadio.com.